Sure. I have other ones, so I don't want to get confused, but I'm gonna do it. Hold on, hold on. You keep cutting out. Hold on. Dang. Okay. I might have put too many, but I have so many macros. Okay, I would calmly go over to the two and I would separate the faction member from the civilian and take them upstairs and remind them that this is not how we behave, that we keep calm, and this is a job, and it's, and I will leave them upstairs on the second floor so that they can calm down, tell them not to come down. I will come back down myself to the first floor and see if the patient is still downstairs being erratic. If so, I will just call PD to come get them because I'm not going to involve myself into a conflict with someone who's already irrational. MD8 is disrespectful conduct toward colleagues, to civilians. Disrespectful behavior toward any individual is prohibited. Punishment is one reprimand or dismissal from the faction based on the leader's decision. MD11 is proper role play conduct. Medical personnel must role play their duties appropriately, including interactions, dialogue, announcing assistance, and checking surroundings during emergencies. Punishment is one warning. MD12 is improper use of tasers, attacking civilians with a taser, weapon, or physical force without an RP reason. Punishment is dismissal from the faction. I feel that it's a terribly disgusting thing for someone to do, and it's horrible for the victim. It should never happen. Absolutely, 100%. That would be a direct disorder to MD-12. So in that case, I would stand by and record at a safe space, and I would hand that over to the chief or DCPs so that they can handle it in a proper way and reprimand. I wouldn't involve myself in danger. Thank you, sir. Okay, that would be a direct violation of MD6 and MD7 actually. And I would then I would actually record, and then I would wait till he comes out of the gang house, and I would ask him if he knows that that's a violation, because some people aren't trained properly and they don't know. And I would still have to turn over the video, but he needs to know, that he violated, so he knows why he would be getting reprimanded. Thank you. As an AP, I would supervise the floor and the West Wing and the staff, which is what I already do in the position that I'm in now. So I know I can handle it. I would also be doing rank up interviews when the DCPs are not available to, and just helping out where they can't or if they're in a meeting, or if they're busy, I would be helping out in their positions. Thanks. I would have already started recording the situation once I saw the BDMing occurring. And when I see the medic trying to tase a person out of their vehicle, I already know that that is a direct violation of MD-12 because they're supposed to be using the taser to escape from danger, not to tase someone out of their vehicle. So I wouldn't do anything in that situation because they're still holding a taser and right now they're dangerous. So I'm going to continue to record. I'm not going to speak or harm the person, but I am going to hand in that video and let the higher ups do what they see fit with it. In that case, I would turn my body cam on, begin recording, wait about maybe 3 minutes in, and I would call the admin to come down and remove the person and review the video. Slash help. I thought, given that it's a direct violation of RP 14, that the admin would have to make their decision on whether they're going to ban the person or anything, because I know the police can't do that. The warning is 60 minutes mute or up to 24 hours to 30 days ban.
Yes, sir. She passed.
Thank you, sir. Thank you.
Yeah. You sure have to post it though. You're welcome.
Thank you.